MDHHS is easing masking across the state of Michigan. I'm News 8 digital anchor Luke Lester here from the Wood TV Live Desk this afternoon, folks. Joining me is Dr. Mansour Yacoub. He's the Chief Medical Officer at North Ottawa County Health System. Dr. Yacoub, thank you for your time. How are you this afternoon?
You're welcome. Thank you. Thanks for hosting me.
You bet, you bet. So I want to talk about here easing these masking requirements in terms of impact here on these restrictions as we kind of continue to navigate life with this virus here. How important is that to take this next step?
I think it's very important. Many people are waiting for this step to happen, But one of the main questions that come to mind is the pandemic is over or not? And if people like to see me wearing this mask or just like that, like normal person. One of the things we need to know that Omicron variant is fading fast, prompting many counties across Michigan to drop school mask mandates, and life once again can be back to normal. But we have to be careful as the last variant, Omicron, pummeled Michigan, spiking more than 20,000 cases a day in early January, before declining to less than 5,000 cases a day in early February. That shows once again that it's hard to predict what's going to happen. And the hospitals, educators, schools, businesses, and business leaders are taking steps and precautions for another possible wave. And I hope and I wish this will never happen again.
You made a mention of schools there. When it comes to schools, there's some kids out there at this point in the pandemic that don't know school without masking, those really young ones. In terms of getting those masks off the kids and kind of moving forward to ease that stress for them on their mental health and even ease the stress of faculty members and teachers, how important is that one?
I think it's very important. I've seen that the kids affected dramatically with anxiety, stresses, depression from not seeing the normalcy. Like they'll be fine to see what they see at home, like no mask at home, no mask at school, no mask in businesses. I think this will help the psychological part of the education. And one important step is that these researchers have found that kids who learn at school do much better than those who are remotely learning, and this will affect everything.
The new mask guidance, again, from the state, it recommends that people still wear them in communal settings like long-term healthcare facilities, health facilities, jails, correctional facilities, shelters, and then it also recommends during isolation and quarantine. What's the next step after this?
I think once hospitals start to see declining in the number of cases, and this might change. And as we learned from CDC website, the rules change on a daily basis. And I think that as the number of cases decline and this mandating school requirement will eventually fade away in everywhere.
What's your biggest fear here moving forward?
I think, we learned that from the first waves that we had, and then the number of cases went declining, and then all of a sudden we have increased in number of cases like Omicron, I'm talking the last variant, infecting thousands of people. Usually the number I have is more than 725,000 infected in Michigan since December. That's equal to one half of the 1.3 million that occurred in the prior 21 months. So you see the surge was going up and then going down and then went up again. So this seesaw had changed the way hospitals, businesses, educators look at the future, and they are very cautious about the next step. They are hoping we don't need to do it again, but they have to take extra steps in case something happens again.
Do you fear that with the removal of masks, because we've been wearing them so much, that there might be a spike in some of the more well-known illnesses, such as sinus infections or the flu, things along those lines, where we're not as covered up by these masks here in public places?
Yeah, I totally agree. I never seen in my career that the number of influenza cases over the last 2 years. So the number is declining dramatically with the mandating mask use everywhere. So my expectation is that we're going to see increasing in the number of influenza cases and possibly what's secondary bacterial infection with sinus infection, like I mentioned.
So as we wrap up here, let's kind of break it down. What do you hope to see the next 3 months, 6 months, and moving forward after that?
I hope to see the continuous and declining in the number of cases hospitalized, the number of positive COVID patients, tests also declining. And this will tell us that probably we're at the end of this pandemic that affected us over the last 2 years. And this will affect everything: schools, educators, businesses. And as you know, businesses mainly rely on schools. So many workers want to put their kids in school or daycare. So if these are closed, businesses will close because no workers will show up to work.
Dr. Yacoub, we really appreciate your time here. Is there anything else that you'd like to add here?
No, thank you for hosting me. And I just want to tell the public that just be safe and use common sense in dealing with these virus infection, like any virus infection, and hopefully we'll look into a better, bright future.
Dr. Yacoub, we appreciate your time. Ladies and gentlemen, there is a link attached to this stream. It'll take you over to woodtv.com where we have this stream. It'll be able to be played back for your viewing pleasure. But in the meantime, this has been a look at the Wood TV Live Desk. I'm News 8 digital anchor Luke Lasser. Have a great afternoon, folks, and we'll see you around.